What's up, guys? My name is Daily Fitness and Bodywork Specialist out here in Southern California. Today I have Ceci here. Ceci has a very interesting problem because it sounds like it's nerve related.
Yes.
So tell me a little bit about that.
So definitely, I have a shooting pain on my shoulder. Like I told you, it's like this last three fingers, and then it comes and goes. What's consistent for me is my sciatica, though, my lower leg, same side. So half of this body is broken.
Okay, that nerve pain is really common, especially with the sciatic pain. So if we have time, I want to address the sciatic pain.
Yes.
But is the main issue the arm?
Yes, exactly.
Okay, so very telling. It's the last three fingers that's going to be ulnar nerve.
Okay.
That's why I asked you. It's this three, radial would be here, and then
Yes.
median would just be like the center.
Okay.
But I'm going to teach you something at the end called nerve flossing, which is
Okay.
going to help keep the nerve healthy.
Is that homework? Like
It's your
something
homework.
I have to do?
Exactly.
Okay.
So what I'm going to do for you, I have to mobilize the muscles around that nerve to decompress that guy so it moves freely through your arms.
Okay.
Okay, so go ahead.
Is that another way of saying I'm out of shape? I'm just not using it. That's
no,
why.
I mean, it's probably just like life. That's something I'm going to
Okay.
go with you and try to figure out why, it's tight like
Okay,
that.
perfect.
Let's go face up first.
Perfect.
I got to ask though, do you exercise regularly?
I do not. I eat regularly though, but
Eat healthy?
I do not. I mean, I eat a lot of rice, so
Yes.
it's not healthy, but I also eat a lot of Filipino food, so definitely not healthy.
That's right. Are you coming from the Philippines? I heard that you primarily live there.
I do not live primarily
don't?
in the Philippines. I haven't been in the Philippines since COVID.
Oh, really?
Yes. I was born and raised in the Philippines.
Oh, I misunderstood.
Yes. Your intel was a little wrong.
Okay, so I'm just testing your mobility first on the shoulder. It honestly looks really good.
Oh,
so that
see?
kind of tells me, so the compression on the nerve usually is the case is going to be like your traps and neck. And so because you don't have a mobility issue with your chest and front delt, it leads me to believe it's just the tightness in your trap
Okay.
and probably your neck that goes down. The thing about this nerve is it spirals down your arm into these fingers. But, so basically I have to work on all the stuff going down here. Because we're in this face up position, I'm just gonna work on your chest and front delt. I'm gonna work down your arm, down your forearm, and then I'll sit you up and work on this.
Okay.
And I'll teach you that nerve flossing at the end. That's gonna
Got
be
it.
your homework. All right, so I usually see nerve issues like this when people sit at a desk, computer. Is that something that you do?
Yes, all day,
All day?
every day.
Seated, do you have a standing desk?
I should, right?
Standing desks are great. But I was talking to my sister and she has a standing desk, but she doesn't use it because it's more comfortable to sit on her
Right.
couch in bed. And I think that's most people.
Yes.
They'll invest in these things that sound good on paper, but they don't do anything with it.
Oh my gosh.
Tight?
This is not the most relaxing, huh?
No,
this is painful.
this is not going to be a feel-good massage. Oh, I forgot to ask. You haven't experienced bodywork before, huh?
No, so there was no disclaimer here.
This is not a feel-good massage. You'll feel better afterwards, hopefully.
Okay.
Let's go ahead and scoot closer to me so your shoulder comes off the table. I'll move this all right there. It's perfect. Okay, so we're going to be here. Sounds like your intel was wrong.
My intel was wrong. My intel just said there's food afterwards.
There's food afterwards.
Yes.
That's not my responsibility.
And you're Filipino too, right?
Yeah. I was actually born in San Fernando. Manila.
Okay.
But I came here when I was like 1.
I was gonna say San Fernando is here. Oh, in the Philippines.
In the
Okay.
Philippines, yeah.
Do they have a different dialect there? No, right? Just Tagalog.
Ilocano.
Ilocano.
Yeah.
Oh,
So I can hear Ilocano way better than Tagalog. My Tagalog's
not good.
okay. I can
very
hear
American.
it. Yeah. I understand the food and the bad words. That's pretty much it.
Yes.
And when the titos are talking about me.
Right.
Okay, girl, here we go.
So what made you do this profession?
It's because I hated accounting.
They want to
So-
be a nurse?
My parents wanted to be like medical field
Right.
or engineer, whatever it is. But how's that pressure? Is it okay? Intense?
It's a little painful. It's a lot painful.
A lot of painful? On a scale of 1 to 10.
Okay, maybe I'm a 6.
6? That's not bad.
So what does the cupping do?
Great question. So what I'm trying to do for everything is trying to remobilize your muscle. What I mean by that is re-lengthen your muscle, because you understand like a tight muscle is short, we want it long. And so there's
Okay.
2 ways to lengthen the muscle. Like a direct pressure, like kneading dough. Do you understand like kneading dough? Like a
Yes.
massage, right?
Yes.
This is negative pressure pulling up on the fascia and the muscle. And that, you get this push-pull effect now. Okay. And so the other thing too is I'm taking your body through movement. So this is considered dynamic cupping. And it's a lot more effective in lengthening the muscle. And instead of I just left it there, a lot of people do static cupping.
Okay.
Not as effective as this.
Okay.
Because this is like naturally stretching out your muscles. Okay, so I'm gonna start you here. Go ahead and push up into my hand up. Keep your arm straight. Go ahead. And then you're gonna do like that.
Okay.
Okay, go ahead. Up, 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 relax. Good job. Good, press up. And relax. Press up. Come on,
I feel
come
like
on.
this is like
Come on,
really
come
making
on,
me realize
come
how
on,
out of shape
come
I
on.
am.
Relax.
My whole body's shaking just to move my arm up.
Press up. And relax. Right there, just let it drop. Okay. Hope you don't mind these circles on your body because they're getting dark. Nice. Okay, you gotta get rid of the pepperonis real quick and then I'll move on.
Okay.
What's it feel like?
Much better.
Really?
Yes.
Are you sure? You're just saying that?
No, maybe I'm getting used to it.
Maybe.
Earlier was
Okay, let's work on the chest just a little bit.
okay.
And we're gonna just be on the upper part here. And then what is it you do with the fighters that you,
Oh, the boxers?
yeah.
We'll pretty much just manage them.
Well, that's
they're,
really
they're,
cool.
all, they're Filipino, most of them are, I guess.
Yeah.
Most of them are Filipino boxers. They probably need this body work more
Yeah.
than I do.
I work with a pro Muay Thai guy.
Ah,
That's local here. I don't usually get a lot of fighters, but just because I have it here,
yes.
I would do some work on like amateur fighters, but in terms of pros, I don't get a lot of that.
Well, I should introduce you to them.
Please.
You are Filipino.
Do you think Filipinos like boxing because they want to be the next Pacquiao?
That is definitely an inspiration, right? But also, like, I think for our culture, like if you talk to these boxers, a lot of them is because it was their way of making money from a very young age.
Sure.
So like they all started like when they're 9 or 10, they do this like boxing matches at their local barangays, right? And then if
Can
they
you move
win,
center again?
if they win, they get prize money. So that's how.
Like significant amount of money?
Not significant, but for a kid, right? It's significant enough to buy
do it
food for the
again.
family to do it again. And then especially if they feel like they have a talent, they keep winning. Then eventually, hopefully, if they get discovered and then they get a manager or somebody sponsors them, one day maybe they could be Manny Pacquiao, right?
So you manage fighters. Do you actively look for new talent?
I don't actively look for them. Usually, they have their coaches, right? And the coach would usually like come to you or come to like a manager that you would know and say, this guy needs sponsorship, or this guy is good at this weight level and this and that, and then somebody would go there and scout there, and then
Whoa.
would say back like, oh, this guy is good. This guy, you should take this guy to the States. He could fight there. Because usually they need that exposure. They need to come here
Sure.
to, you know,
Just make a name for themselves.
to make a name for themselves, to win, you know, their belts, right? Because if they're just stuck in the Philippines, they're not really gonna go anywhere.
That's so true.
So a lot of it for them is like a lot of hard work, but also like some luck, you know?
Oh, for sure. I was watching like randomly the one championship at my barber,
Yes.
and there's like quite a bit of Filipinos that are in there.
Yeah, I mean, from the weight class I want to say 105. There are some boxers
Yep.
105, smaller than me. From 105 to 144, it's very predominantly Filipino fighters. But now, this Japanese fighters, the boxers are taking over.
Oh yeah. There's this. He used to come here just to train a little bit. Daishin. He's Japanese. That guy's scary. Shout out Daishin. But he opened his own gym like in Irvine somewhere over here.
Oh, okay.
Yeah. Super nice. But like really scary when he's hitting the bag. I'm like, oh my God.
You're like, can I hold the bag for you?
I'd be scared to do that.
Yeah.
Okay, so what I'm doing right now, I'm going over your bicep. I'm shortening and then naturally lengthening your body. That's why I keep bending your arm.
Yes.
So naturally stretching your muscle as I glide across it. So just remember, what I'm trying to do is just re-lengthen all your muscles to try to decompress that nerve that's going through your arm like this.
What usually causes that? Just lack of use of.
I mean, the way I answered that question is a tight muscle is a weak muscle. So going back to like why people should train, it's honestly to prevent this tightness from happening.
Oh, the truth's a little hurtful.
I know. Well, most people don't want to change. You're at least taking the first step in like getting this
Yes.
and giving it a chance, because most people won't even. I'll say this: a lot of people just accept their pain,
Right.
which is like really sad. And even if we get older, you know, 50s, 60s, 70s, like you shouldn't be in pain. Physical pain, emotional pain, I
Right.
don't know. That's out of my scope. But hopefully, so the nerve thing, in my opinion, is like it's hard for me because I can't really test
Yes.
what you feel. I can only test like mobility stuff.
Yes.
And because you don't have a big mobility issue, I'm definitely gonna follow up with you to make sure it at least feels better.
Yes.
But as long as you're doing your homework that I'm gonna tell you at the end. Okay, let's start working down the forearm.
Okay.
You're doing really good already. So I'm going to bend your arm or your hand down. This is gonna naturally stretch this inside part of your forearm.
Oh.
And same thing like your bicep, I'm shortening and then lengthening as I move your hand up and down like this.
These small movements makes a big difference.
Oh yeah. Are you left-handed?
I am not.
Okay. So we gotta figure out what's putting your left side out of alignment.
Right.
Usually it's sleep. So my next question is, how do you sleep?
On my left side.
Ah.
There you go.
So just imagine, I don't know how old you are, you don't have to tell me, but years of compression
I'm
going.
52.
Are you?
Yeah.
Are you?
Yeah.
No way.
I'm Filipino too, you know?
Are you 52?
Yeah.
What?
Yeah.
You look nowhere near 40. Seriously. What the heck?
I'm not.
Wait, how old are you?
34.
Girl, what the fuck? Trolling me.
You should-
I'm Filipino. I was like, I kind of believe it. Yeah, so 30 years of compression going into your
Yes.
shoulder. This girl. Okay. Okay, seems like you're tolerating this really well, so I'm gonna do something called,
Something more painful.
well, some people say it's painful, some people don't
Okay.
think it is at all. So that's why I'm saying I think you can tolerate what's called a cup glide. It's really fast, and some people say it's the most painful thing. Some people say it doesn't feel like anything. I think you'll be the latter.
It's sensitive, it's painful, but it's tolerable.
Yeah. Oh my God, you said that with a straight face. I'm 52. I was like, what?
All right. I think as Filipinos are good till we're like 60, then it just
Oh my
go
God.
downhill from
That's
there.
so true.
Like,
My mom looked the same up until 65, and then I was like,
yes.
oh,
Oh, careful, your
I
mom
see
may
now.
be watching this.
no, she's not watching YouTube.
Just careful.
But they do, like Asian
Yes.
people in general age really well. Okay, let's try that cup glide for you. Best of luck to you.
Let's see.
Okay, nothing's happened. I'm just putting more of this massage cream on so that way it glides really easily and doesn't hurt anything on you. Let's use the blue one. So I'm gonna go half click on this. Boop. I'm gonna go up, down, side, side, side.
Uh-huh.
Up, down, side. That's it. How'd that feel?
This is good. That was fast.
Yeah, it's fast.
Yes.
You don't need to do it for a long time.
Yes, yes.
I'm gonna do it on the other side. Up, down, side, side, side. Ooh, that's way too much pressure. Okay. Oh, you're chilling on this side. Okay, let me do that side again. To grab. Side. Cool.